Hi, this is another Beyond Lived Experience Diaries episode. I kind of wanted to talk about medical gaslighting and also trusting your instincts. You'll notice I'm in kind of a different getup today with the glasses and the hat. I've been having these pretty bad migraines and wanted to keep the lighting low, keep my voice a little lower than I normally would, and just kind of meet myself where I'm at today. I also have been trying not to get too focused on how I appear in these videos because I think I've been really focused on like appearing a certain way, which is why I've not maybe worn sunglasses when it would have been helpful. These are actually blue light blocking, so they do help with the migraines, and the hat kind of squeezes my head a little bit. So medical gaslighting, for those who don't know, is kind of like how folks in these medical or mental health systems will sometimes like create a narrative to push on to patients or people accessing services. And my experience has been that as somebody who has been diagnosed with bipolar disorder in the past, now I am an unreliable narrator about my own experience. And anything I bring up related to side effects related to psychiatric medication or coming off of those psychiatric medications, I'm told that the only one who can help me is a psychiatrist, even though a nurse practitioner is the one who I feel messed my brain up. And it's funny how, like, as a patient, these systems don't want patients speaking outside of their expertise, but often providers will speak outside of their expertise and say, oh, this symptom isn't normally connected with migraines, when they don't know about migraines because that's not their area of expertise. And I really wish these systems would treat patients as if they are the expert in themselves, because who knows us better than anyone? Ourselves. We've been living in our bodies our whole lives. And I think I really don't like being treated like I'm going to like doctor shop and go to all these different providers and tell them all different things, because actually I've been trying to tell all these providers the same thing, and I keep being told, you need to talk about this thing with this provider, and you need to talk about this thing with this provider. So actually I'm being encouraged to tell different things to different providers, and it's kind of ironic, isn't it? So my little rant there is just really a symptom of how crappy I've been feeling. Like, there are times I've been just trying to get through the minute, the hour, the day. My medical leave at work got extended, so I have a lot of time on my hands to just think and talk to people and explore and figure things out. I'm considering switching therapists because my last experience with my therapist was not great. And I just really want somebody who's speaking my language, and I think what my language is now is the language of anti-psychiatry. And I thought, if a couple months ago you told me that I would become anti-psychiatry, I would have been like, no, it's fine, things are getting better. But like, really, there is so much that has not changed in the last decade or previous decades of like this attitude of treating patients like they don't know what they're talking about, like super condescending, no collaboration. And I've had psychiatrists that are collaborative, so don't get me wrong there. But what I'm learning is they're the exception and not the rule. I had a psychiatrist tell me that actually going through school, when psychiatrists go through school, they have lowered amounts of empathy towards patients than when they enter school. So what does that tell you about this system and the way that we have it set up? It is actively encouraging less of that collaboration and empathy and more of this power driven, profit driven way of doing things. And I'm sure I could go on all day. I'm trying not to give myself cramps. I've been getting these muscle cramps, and sometimes my emotional state can influence these cramps, these migraines. And I just spilled broth on myself. Sometimes I feel like my body kind of knows what I need more than I do. So if I spill something, I take it as a sign that maybe I shouldn't be drinking that anymore. Like, I'm getting a little bit shaky. But at any rate, I really just want to imagine a system where we can have this collaboration, where patients can come in and say, hey, like, I really want to try out this medication. I did my research based on how I've responded to medication in the past. This is what I would like to try. And psychiatry doesn't always work that way. And what would we call it if we had this patient-driven form of medication management? I don't know. I would be interested to learn if, like, there are ideas for different names for that. I really just don't want other people to go through the experience that I've been through. I was overprescribed stimulants, and it almost like turned me into a different person. And these medications can like totally alter your personality and mask a lot of things that, I feel like I haven't been my authentic self for the last year and a half on all these psychiatric medications. And, I'm still on some, but at least, I advocated for myself and want to go back on ones where I did feel like I was able to be myself. I was able to be in consensus with all these different parts of myself. And it's all very complicated. It's going to take time, but at the very least, I am feeling hopeful about the future. So thanks for listening to my little rant, everyone. And I'm going to keep doing these little sporadic diary episodes. Feel free to leave a comment, leave a like if you're on YouTube, and I'll see you next time.